How often should you get tested for HIV? Do you know which HIV test is right for you? It's an important question, but one that many people are unsure about. Let's take a quick look. In this video, we will explore 3 primary types of tests: antibody tests, antigen tests, and RNA tests. By the end, you'll have a clear understanding of how each test works, when to use them, and what their results mean for your health. Why testing for HIV is important. HIV, or human immunodeficiency virus, affects millions of people worldwide. While this virus can be managed, early detection is key to effective treatment and prevention. That's why it's so important to understand the types of tests available. Testing is the first step toward knowing your status and taking control of your health. But before we begin, let's take a moment to reflect on why testing matters. If there's one thing that can protect your health and peace of mind, it's knowing your status. Testing for HIV is a simple step that could make all the difference in not only your health, but also the health of your loved ones. Don't wait to take action. Taking that step to get tested could mean a healthier, safer future. Remember, early detection leads to better outcomes, so don't hesitate. For fast, affordable, and confidential HIV testing, visit official website HIVRNAtest.com today. With over 4,500 testing labs across the United States, you can find a location close to you. 3 main types of HIV tests. There are 3 main types of HIV tests: antibody test, antibody antigen test, and HIV RNA test. Each serves a specific purpose and is effective within different timeframes after exposure. 1. Antibody tests. Let's start with antibody tests, the most common type of HIV testing. What are the antibody tests? Antibody tests detect HIV antibodies in your blood or saliva. These antibodies are proteins that your immune system produces when exposed to HIV. How antibody tests work? With these tests, a simple blood draw or saliva sample can reveal if you've developed antibodies to HIV. The results are generally available within a few days. When are the antibody tests effective? Now, antibody tests are typically effective around 3 to 12 weeks after exposure. This is known as the window period, the time it takes for your body to produce enough antibodies to be detected. So, if you've recently been exposed, this test may not be conclusive right away. It's best for those who are a few months past potential exposure and want a reliable test result. 2. Antigen-antibody tests. Now let's talk about the combination antigen-antibody tests. What are the antigen-antibody tests? This test detects both HIV antibodies and antigens, which are parts of the virus itself. The antigen targeted here is called P24, which is detectable in the blood soon after HIV exposure. How antigen tests work? This is a blood test, and it works by detecting the presence of the virus's antigens alongside your body's antibodies. This dual approach allows for earlier detection compared to antibody-only tests. When antigen tests are effective, antigen tests can detect HIV as early as 3 to 4 weeks after exposure. They're often available as lab-based tests, and the results are typically ready in a few days. If you're looking for a test soon after a possible exposure, the antigen-antibody test may be your best option. 3. HIV RNA tests. Finally, let's explore HIV RNA tests, one of the most advanced options available. What are the HIV RNA tests? The HIV RNA test is a specialized blood test that detects the genetic material of the HIV virus, specifically its ribonucleic acid, RNA. This test is particularly significant for several reasons. Key features of the HIV RNA test. Early detection. The HIV RNA test has the shortest window period of any HIV test, capable of detecting the virus as early as 9 to 11 days after exposure. This is crucial for individuals who may have been recently exposed and are experiencing anxiety about their HIV status. Mechanism. Unlike traditional antibody tests, which look for antibodies produced by the body in response to HIV, the HIV RNA test directly identifies the presence of the virus itself. This makes it a valuable tool for diagnosing acute infections. Viral load measurement. The test also measures the amount of virus present in the blood, known as the viral load. This information can help healthcare providers assess how active the infection is and how well treatment is working if the individual is already diagnosed with HIV. When HIV RNA test is used, the HIV RNA test is recommended in various situations like if an individual believes they have been recently exposed to HIV, when early symptoms of HIV are present, to confirm or clarify results from other HIV tests that may have produced conflicting results, for monitoring the effectiveness of treatment in individuals already diagnosed with HIV. HIV RNA testing process. The procedure for an HIV RNA test involves a healthcare professional will draw a blood sample from a vein in your arm. The sample is sent to a laboratory for analysis. Results are typically available within 24 to 48 hours. Cost and accessibility. While the HIV RNA test is highly accurate and beneficial for early detection, it is affordable, fast, and reliable as compared to other standard antibody tests, generally costing around $129 only. Due to its cost, it is widely used for quick screening. If you are considering higher risk, you can take STD panel test as well, which is $259 only, including HIV RNA test. In summary, the HIV RNA test plays a critical role in early diagnosis and management of HIV, providing timely information that can significantly impact treatment outcomes and overall health. How HIV RNA tests work? By drawing a blood sample, an HIV RNA test can identify HIV infection as early as 9 to 11 days after exposure. This makes RNA tests some of the fastest acting tests on the market. Choosing the right HIV test. So with these three options, how do you decide which one is best for you? For recent exposure, 9 to 14 days. HIV RNA test is the fastest way to detect an infection if you've had a very recent exposure. For early detection, 3 to 4 weeks. Antigen-antibody tests provide a reliable middle ground for those who are just a few weeks past exposure. For past exposure, 4 to 12 weeks. If it's been a few months, an antibody test is a good option and is widely accessible. Testing regularly, especially if you're at a higher risk, can help you stay informed and take early action if needed. Importance of confidential and accurate testing. Choosing a reliable, confidential testing service is key to peace of mind and accurate results. If you're ready to take control of your health, visit HIVRNAtest.com for quick, affordable, confidential HIV testing across the United States. Our network of certified laboratories provides discreet testing with rapid results. Take control of your health today. Thanks for watching. Please like, share, and subscribe to our channel for more videos like this.